Hello, in today's lesson, we will be talking about the 3 stages of labor. But before we proceed, I would like to draw your attention to the definition of some few terms, that is, labor and delivery. Labor is the process by which the fetus, the placenta, and membranes are expelled through the birth canal, while delivery is the expulsion of viable fetus out of the womb. From the definition, it is very clear that delivery is not synonymous with labor, as it may occur without labor. Delivery might be vaginal or abdominal. Vaginal delivery can be spontaneous or it can be aided. Now, let's talk about the criteria of normal labor. For us to know if there is abnormality, then knowing the normal condition is necessary. Labor is called normal if it meets the following criteria. It should be spontaneous in onset, and it should occur at term. It should have vertex presentation without undue prolongation, that's within 24 hours per vaginal, natural termination with minimal aid, and it should be without complication to the mother, baby, or both. Now, from the understanding of normal labor, we can easily identify if labor is abnormal. Any deviation from the definition of the normal labor is called abnormal labor. Now, let's talk about the stages of labor. Labor is a continuous process, but in order to understand, it's conveniently divided into 3 stages, although in some other literature, a 4th stage is added. The first stage of labor starts with the onset of true labor pain and ends with the full dilatation of the cervix. In other words, it is the cervical stage of labor. The average duration is 12 hours in prima gravida and 6 hours in multipara. Second stage of labor. It starts from the full dilatation of the cervix and ends with the expulsion of the fetus from the birth canal. It has 2 phases, the propulsive phase and the expulsive phase. The propulsive phase begins with the full dilatation up to the descent of the presenting part to the pelvic floor. The expulsive phase is distinguished by the maternal bearing down efforts and ends with the delivery of the baby. The average duration is 2 hours in prima gravida and 30 minutes in multipara. The third stage of labor, it begins after the expulsion of the fetus and ends with the expulsion of the placenta and membrane. Its average duration is about 15 minutes in both prima gravida and multipara. However, the duration is reduced to 5 minutes in active management. This stage also involves the control of bleeding. As I have said previously in our discussion, some other literature add 4th stage of labor. It is the stage of observation for at least 1 hour after the expulsion of afterbirth, that is the placenta and membranes. During this period, general condition of the patient and the behavior of the uterus are carefully monitored. That is the end of our lesson. Thanks for watching.